everyone, and welcome to MediByte. Today, we're going to talk about a really painful and often kind of confusing condition that can stick around long after a common illness is gone. We're talking about post-herpetic neuralgia. So let me ask you something. Have you, or maybe someone you know, ever had a bout of shingles and then wondered, why is there this pain that just won't go away, even when the rash is totally gone? Well, that is exactly what we're going to unpack today. All right, let's dive right in. Okay, so here's how we're going to tackle this. First, we'll define what this lingering pain actually is. Then, we'll trace it all the way back to shingles. After that, we'll get into the symptoms and who's most at risk. Then, we'll look at how it's diagnosed and treated, and we'll wrap it all up with the key things you really need to remember. All right, first up, let's get a really clear handle on what we mean by this lingering pain. Okay, so here it is. Post-herpetic neuralgia, and you'll hear people call it PHN for short, is basically a type of chronic nerve pain. And the name itself actually tells you a lot if you break it down. Post means after, herpetic refers to herpes zoster, that's the virus that causes shingles, and neuralgia just means nerve pain. So it's literally nerve pain after herpes. Makes sense, right? But here's where things get a little murky. Researchers are still trying to figure this one out. We know the shingles virus is the culprit that damages the nerves, but the exact reason why some people get this chronic pain and others just don't, well, that's not totally understood yet. It's a huge area of ongoing medical research. So that leads us perfectly into our next section. Let's follow the breadcrumbs. How in the world does a common childhood illness end up leading to such a complex and painful condition years down the road? You know, this slide lays it out perfectly. It all kicks off with the varicella zoster virus. That's the one that gives you chickenpox when you're a kid. Now, here's the kicker. After you get better, the virus doesn't just pack up and leave. Nope. It goes dormant, just hiding out in your nerve cells for years, sometimes decades. Then, something can trigger it to reactivate, and boom, you've got shingles. And for some unlucky folks, even after that shingles rash finally clears up, the nerve damage left behind leads straight to post-herpetic neuralgia. It's like this four-step domino effect. Okay, so what does this pain actually feel like? And maybe, more importantly, who is most likely to get it? Let's dig into the symptoms and the biggest risk factors. So, the number one symptom, the big one, is this persistent nerve pain. And it's very specific. It happens in the exact same spot where the shingles rash was. Now, this pain isn't always the same. For some, it's a constant grinding pain. For others, it comes and goes in waves. And it can be seriously severe, like really debilitating. And the worst part, it can hang around for months or, in some cases, even years. And look, don't just take my word for it. This quote from the MSD manual really drives the point home. It says the pain can be severe and even incapacitating. That word, incapacitating, is so important. It really speaks to just how life-altering this pain can be for people who are suffering from it. So, who's most likely to get this? The science on this is crystal clear. While technically anyone who's had shingles could develop PHN, the single biggest predictor, by far, is age. And this chart really paints a clear picture. It's a pretty direct relationship. The older you get, the higher your chances of developing post-herpetic neuralgia after you have a shingles outbreak. It just climbs and climbs. Okay, let's switch gears and get practical. How do doctors figure out if you have PHN? And the million-dollar question, what can actually be done to find some relief from the pain? You know, diagnosing this is usually pretty straightforward. If a person tells their doctor they have this lingering pain and it's in the exact spot where they just had a shingles rash, well, a doctor can typically diagnose PHN based on those symptoms and a physical exam. It's usually that clear. Now, this part's really important, so I want to be super clear. When it comes to treatment, we have to set the right expectations. Nerve pain is just tricky. And as our source material points out, there's no single magic bullet that works for everyone. It's really about finding a personalized approach, figuring out what works for you. So this slide gives you a great overview of the main toolkit doctors have to work with. And what's interesting is that it often includes medications that were originally made for other things, like seizures or depression. Why? Because those drugs are good at calming down the overactive, haywire nerve signals that are causing the pain. Other options include things you put right on the skin, like lidocaine patches to numb the area, or even injections that try to block the pain signals right at the source. Whew, we have covered a ton of ground. So before we finish up, let's boil all this down into the most important need-to-know points from our explainer today. Okay, let's do a quick-fire recap. What do you need to remember? First, PHN is chronic nerve pain that shows up after a shingles rash. Second, it's all thanks to that same pesky virus that causes chickenpox. Third, the #1 risk factor is getting older. Fourth, diagnosis is pretty direct based on your symptoms and your history with shingles. And finally, and this is the hopeful part, while there's no single cure, there are a whole bunch of different treatments that can help manage the pain.
And all of this leaves us with one last question to chew on. With so many people living with chronic pain conditions like PHN, it really makes you wonder, right? What's next? What new approaches or breakthroughs in medicine are just over the horizon that could finally bring more effective, more consistent relief to people? Thank you so much for joining us for this MediByte explainer. If you found this information useful, we'd be so grateful if you'd share it with anyone else who might need to see it. And of course, be sure to like and subscribe to MediByte for more simple, clear health information. Thanks for watching.